I'm Komal Afzal. I'm a pediatrician here in Los Gatos, and the decision that came out this week with the Supreme Court overturning Roe v. Wade was quite shocking, to say the least. It overturned the federal court's protection of women across the country
and
embryos to protect them against abortion, and now has left it up to individual states to decide. On the medical front, as a pediatrician, of course, we immediately go towards our young pregnant teen patients and how we'll deal with emergency contraception.
Ectopic
pregnancies. I think the emergency room and emergent situations that people a lot of times don't think about, how an ectopic pregnancy should be handled, because that is a life-threatening condition for a pregnant mom.
Bleeding placenta,
and those, the treatment for those is abortion in a medical environment, and that sort of decision and care is being taken away from physicians. That autonomy to provide for moms and pregnant moms, I think, has become a really difficult conversation. I think when we think about embryos, as you had mentioned, in vitro, there's a lot of conversation now and decisions being discussed at, for women who have saved their embryos for possible future family planning and not unsure if they want to access those embryos, maybe being forced to keep those embryos and unable to discard or, decide at a later date what they would like to do. I think there's a lot of sensitive topics that people don't really consider, and I do worry for the well-being of our patients, and I think it's going to span lots of different age groups and a lot of unique situations that I think has just not really been discussed.
Also for modern medicine, what we know to be about modern medicine today, if you want to have a baby, and what it means to have in vitro fertilization, and then does that mean the rest of the embryos that we have to keep forever, and then we have to have a trust fund for them after the parents die to keep the embryos alive
for storage,
and what does it all mean, this fertilized egg? And what about men who choose to donate their sperm? What happens to that? These are all new ground for ethics and science, and how do we define life? A sperm has life, and once it fertilizes an egg, it becomes even more special. But what does that really mean? Does that mean for the time of conception, how to define that? And it's a very interesting ethical time, and for us as doctors to suddenly turn on a dime, and that we're suddenly responsible for all these decisions, which we never really
we're having to navigate legal jargon and terminology and consult our lawyers first before making decisions. I think that is sort of a new arena for many of us,
since we didn't go to law school.
That wasn't what we ventured down.
And in addition, for ectopic pregnancies, that's not planned. We don't know which pregnancy will become ectopic. And then if it becomes ectopic and you don't abort that pregnancy, what happens? And we know that if we let the ectopic pregnancy just explode in the abdomen, the woman will die, the parent will die. So this is a problem. And then what happens if you're a mother and you come from a state that is pro-choice, but you travel out of business, and you go to another state, and suddenly your placenta ruptures, and then what happens? You can't get back to a sanctuary state in enough time, and bleed to death on the airplane.
All a tons to think about, and I think a ton is coming our way, and it's quite sad that it's become more of a legal political conversation and not a private medical conversation between a doctor and a patient.
And also, if the fetus is indeed endangered, at what point is it endangered to the point that it affects the mother's life?
Right. How do you define that?
How do you define that? And that was the article, June 12th, New York Times, about Poland, where no doctor wanted to do any abortion, even though the fetus died and then the mother died as well.
Right.
So these are interesting questions.
Yeah.
So thank you for joining us, and these
Thank you.
are more questions for us to consider.